I'm Laura Wheatholder. I'm a registered nurse and community outreach coordinator for Blessing Health System. I'm here with Brandy Tallman, who is our SANE coordinator. Would you like to take a minute to introduce yourself?
Yes, ma'am. I'm Brandy Tallman. I'm the SANE coordinator at Blessing Hospital. I've been at the hospital for about 8 years now, but in this role about a year and a couple months.
All right. So SANE nurse coordinator, we're talking about sexual assault nurse examiners, yes, correct? Okay, so tell me, what is a SANE nurse? What is this role that you help fill?
We see patients who present to the ER or anywhere in the hospital who have been sexually assaulted or are concerned that they have been or their child has been. So we do several specialized things for them, most of which is required by Illinois state law.
You provide a very important service at a very difficult time. So these are people who have been sexually assaulted or, even minors who have maybe experienced something. And you guys go in and provide critical care. Talk about how that process starts. What are you doing when you go into the room and meet a patient?
So typically, first, when we meet the patient, we introduce ourselves, tell them who we are, that we are the SANE nurse, the sexual assault nurse examiner, because most people don't know that term. Mm-hmm. Tell them what we're here for, and then tell them a little bit about the services we offer, the things that they can choose, the things if they don't want, we don't have to do, and then go through the options for an Illinois State Police sexual assault kit if that's something they choose to do.
So a portion of this, and it's optional as you've said, is collecting evidence so that if there is evidence of criminal activity, that can be pursued by law enforcement, correct?
Yes, ma'am. We go in if the patient wants to do a sexual assault kit. There is a consent form that comes with it. They can consent to an exam, they can consent to evidence collection, and they can consent to photographs. Some patients choose all of the above, some choose one here or there, or they say yes to one and then get to that point and they're like, I don't want to, which is fine. And then we don't, no recriminations, no.
Everything is 100% up to the patient. Yes. So it's trying to protect their integrity, their privacy, be respectful of them, but at the same time give them options for how to move forward. Yes, ma'am. Now talk about the training. You're our SANE nurse coordinator, so that implies that there are more than one nurse who's in this role. So talk about the training that our staff go through to be able to carry this credential.
So you have to have been a nurse for at least a year. So then we send them to a International Forensic Nursing Association approved didactic class or classroom portion. The Illinois State's Attorney General's office actually offers that course for free to any nurses who want to go. But if you do it online, then it costs about $600. Oh, okay. So we send the nurse to the didactic. It's 3 days in-person training, and then when they come out, they have the beginning knowledge they need to do a sexual assault kit. Then they get a clinical log from the state, and that's the portion that tends to take the longest. It's around 40 to 60 hours outside of work to complete those. And then so for adult and adolescent SANE, patients who have gone through puberty and up to all ages, that nurse has about 6 or 7 steps to go through for that clinical log. For pediatric adolescent SANEs, there are 6 steps to go through for that clinical log.
So this is a pretty big training that these nurses go through. It's a certification, correct?
Yes.
It's a state certification. So no small feat. It takes a lot of training, but it's a very important role that they're filling.
One of the things is Illinois law requires that we have 24/7 coverage for all age groups because we are a full treatment facility. We have 2 transfer facilities that send us patients also if need be, but we treat all ages.
And how many SANE nurses does Blessing have right now?
We have one SANE A, which is actually a nationally certified test you can go and sit to take after you've had that certificate for 3 years or done 300 hours of service for SANE patients. So we have one SANE A, 9 AA SANE or certified by the state, and then 4 in training for adult and adolescent. We have 1 SANE P for the pediatric, 3 PA SANE or pediatric adolescent SANEs, and then 6 in training for the pediatric.
So it's a Blessing has really obviously put a lot of resources to this because we feel strongly it's important. How does this program help patients? What does this provide them?
So the basis of SANE or SANE programs is that reducing re-traumatization of the patient with trauma-informed care. So our SANE nurses are taught specific ways to help reduce the amount of trauma, reduce the number of times that patient has to repeat that story to the staff, to anyone else. So when they go to do that assessment, that kit, then that is the only time they're supposed to be asked what happened in detail while they're in the hospital.
So trying to provide them with the best care possible while also providing them care that's empathetic and sensitive to the situation, while also potentially helping preserve very important evidence.
Yes, ma'am. Very important evidence, and also injury identification and treatment for those. Occasionally we'll have a patient who'll need a CT, who'll need stitches, assessment for strangulation, things like that.
So just providing care to the whole patient in every aspect that they need. Obviously, this is something that is very important to you, very important to the hospital. Can you talk about why? I mean, this is relatively new for the hospital to have SANE nurses, at least at this capacity.
Yes. I actually took the initial SANE course by accident. Oh. It's one of those that's required for ER employees to take a sexual assault class. It used to be like an hour class just for the ER. My friend is like, hey, you want to go to this class with me? I was like, sure. Wasn't what I thought it was. But then I got into it and I was like, oh, I think I want to do this. So the class initially was an accident, but finishing it has been something that I've really felt passionate about.
So coming into it by accident and you found a passion and obviously something that's a great service to our patients and to the health system. Is there anything else about the SANE nursing program that you would like to add? Anything that maybe people don't know that you feel is important to share?
About the program itself, we're always looking for more SANE nurses. It doesn't have to be an ER nurse. Actually, the more that I can get that aren't ER nurses, the better, because then I have more of a pool on call that I don't pull from the ER staff or the ER floor, especially if it's busy. Also, chances are everyone has someone in their life who is a survivor of sexual assault or sexual violence, even if you don't know it. 1 in 4 women in the United States have been sexually assaulted, and 1 in 6 men.
What about our outpatient setting? Is this something that's open to nurses on that side?
If they are willing and able to finish the clinical log, yes, ma'am. Any RN that's been RN at least a year and can partner with the ER as a clinical preceptee, then yes. It is something that you have to be passionate about. There is a lot of outside of work time to complete that clinical log, but then once it's complete and you're able to help that patient one-on-one, it's wonderful. They are all appreciative. Sometimes we'll have patients come back, or our Coronado advocates come back after having seen the patient later, weeks, months, and they're like, they really loved you, you were wonderful, you made everything so much easier for them, things like that.
Is there anything else that we missed? Anything that you'd like to add?
They have 7 days from the day of the assault to present to any ER in Illinois and have that evidence collection kit completed at no cost to them. We do put all of our patients in contact with Quinata. It's one of those state laws. Every sexual assault patient that presents to the hospital, we call Quinata. They have to come, they have 60 minutes to present, and they have to knock on the door and say, hey, we're Quinata. If the patient wants to see them, that's fabulous. They have wonderful resources for them. But if they choose not to, then they just say no thank you. Quinata may leave them a packet with the SANE nurse, or they may leave them some clothing, because sometimes we collect that from the patient. But then they'll leave.
All right. Well, thank you very much. We appreciate you taking the time to be with us today.